Yeah, Life Simple 7 was developed over 10 years ago. The lead scientist on that is Dr. Don Lloyd Jones from Northwestern. He's actually now the current president of the American Heart Association. But back in 2010, we had our goal was to improve cardiovascular health, not just prevent heart attacks and strokes. And when we did that, we had to actually define what cardiovascular health even meant. And so that became the origin of Life Simple 7. These are 7 factors that are well documented and related directly to cardiovascular health. So there's 3 that are in the behavior category, so physical activity, nutrition, and tobacco cessation. And then 4 that are basically biometrics, so weight, blood pressure, cholesterol, and glucose, which can lead to diabetes. Now, you may be sitting here thinking, well, there's some missing elements, aren't there? Probably the biggest, I wouldn't say missing element, but the thing that we have to address also is the mental health of the individual. And not just do they have depression or anxiety, but their level of engagement and motivation, their ability to adopt behavior change. So all of that, so that mental health actually is embedded into all 7 of those other categories. And then, of course, the other thing, because we are preventing conditions, we also have to add medication adherence to that as well, to help sustain that really important behavior change of taking your medicine as prescribed.
That's definitely a great tool to have, and we talk about that a little bit later on. But I want to go to Anil now, really also understand, how Anil is shaping this up at IntelliEdge, some of the great case studies that you have come across. Would really like to get those perspectives.
Sure. So as you know, Santosh, we are in the business of, wearables and home monitoring. So our company basically is trying to bring the latest technology so that the patients are much closer to their care providers. And that happens through these wearables where the data is available to a given care providing team on a regular basis, whether you're monitoring hypertension, whether you're monitoring change in weight for the congestive heart failure patients, whether you are monitoring the glucose variations that are beyond the normal ranges. So this, I will pick up on what Sri said. The whole point that we are focused on is on scale and precision. It's a huge concept. In other words, if I can actually monitor blood pressure of 1,000 patients using the dashboard that we have, at the same time, I'm able to see what kind of medication is most optimal for a given patient at what dosage and what combination of medicine. I have basically, because I'm getting the data on a daily basis. In fact, we are doing a study right now, or a program with one of the large academic health centers on the West Coast, where the trial is looking at the CHF patient, congestive heart failure patients. But because of certain kinds of medication these patients are given, they monitor the blood pressure of these patients. So these patients using IntelliEdge system are basically recording their blood pressure twice a day. And each time what they do is they take 2 readings of blood pressure, because blood pressure kind of varies from time to time and the way you take your readings and stuff. And that information keeps coming on a regular basis to the providers, to the physicians, to the cardiologists. Now they are able to see for a particular patient. So this becomes a much more individualized operation in terms of why this patient is seeing these kind of side effects or not seeing the improvement. So you can plot the medication that they are taking and the blood pressure trend that they are seeing. So you can customize and you can optimize a particular patient's medication and its dosage levels. So that's the level of operations we want to create, not in 1-by-1 setting, but 1 to 100 patient setting, where a mid-level professional is able to manage on a dashboard what is happening with a given patient that she's monitoring 100 or 150 at a time. So that we are pretty excited about those kind of innovations that we are bringing, to the marketplace. One other example I will give you in terms of the innovation. We have a customer in the hospice environment, right? So what we have done, we have collaborated with a robot company. It's called the Tammy Robots. So on the head of the Tammy Robots is basically a tablet on which our software runs. So this robot goes from room to room in patient's home, take the readings, and the physicians can actually have a telehealth call with the patient if they see some unusual readings coming from that particular patient. So you actually have a rounding done by your robot with the technology that we have created. So it brings efficiency and it monitors these patients on a daily basis at a lower cost. So those are some of the innovations and the kind of changes that I think the technology can bring in the marketplace.
Fascinating. Some of it sounds like sci-fi from where we used to be, but it definitely is becoming more a reality as we were talking about. How is the acceptance from patients about some of these technologies? Are they, how are they approaching this? What do they think about this?
Yeah. So when we started the program, one of our earliest patient was 92 years old. She was, and her son basically said that I think she has signed up for your program, but it is not for her. The mother immediately said, no, I can actually do it. And she was one of the more consistent patient to send her data to her physician. And it was not just the sending the data. I think she found a social connection. She was able to connect with nurse, with a patient through this medium. And otherwise, she's sitting at home alone, right? Now she actually is engaging. So one of the side benefits of this remote patient monitoring and home monitoring is the social engagement, the patient engagement that is actually happening. And that is actually good for the providers as well as for the patients.
I think that's a fascinating point. A lot of people think that technology is kind of going to take away the personal touch, but it can also be used in this way where we can increase the personal touch, the interaction with the patients. And that's a fascinating point. I really feel inspired about it, the way you explain. Sri, I'm going to come to you and also get perspectives about our work at Rain Foundation and also some of the cases that we have seen from our perspective.
Yeah, so I think, so what Pat mentioned and what American Heart Association is doing, I mean, it's amazing. They spend millions of dollars, right? Tens, hundreds of millions of dollars on research. And that research is done by Stanford Health, Johns Hopkins, really who's who in the healthcare industry, right? And what Anil touched about is how can we take that research and apply it in a more acute care setting, like when somebody is in need of care and continue. But when you look at what we talked about in the past, how do we make such a thing available to a low resource setting where people may not be able to pay, right? That's where we fill the gap, right? So when we're not going to be able to offer what IntelliH offers, right? So to give you an example, when you're talking about like the example that Anil gave, how do I monitor glucose levels, right? We're not going to go to that level, right? What we're going to say is, at least let us get to a point where I may not know exact, quality of calories that are going into my body, but can I at least start a discipline where I know overall I'm consuming 2,000 calories, burning only 1,000 calories. So it gives an indication, right? So we are focused on very low fidelity, free service in a public health wellness setting, right? And all of us, we will try to move up the spectrum, and Anil and they will try to make their service more accessible, right? Today, their service may not be affordable in India, but I'm pretty sure in a few years to come, it will be very affordable in India. I mean, I'm sure there are some people now that can afford this service, but I'm talking about for them to make business sense. But some of the customer base, when we're talking about rural India or Africa, it might take a while for them to be able to afford such a service. But what can we do for them, applying some of those Life Simple 7 principles, right? So we are particularly focusing on those principles. We benefit a lot from the American Heart Association research and the guidance that Pat gives us in terms of all of these activities, like medication management, vital management, symptom management, nutrition management, physical activity management, and mental stress management, right? These 6 pillars, we want to try to find free, low fidelity, easily accessible solutions. That's our role.
And so you definitely talk about this also in our discussions, especially with regards to the access and how to improve this through technology that is open sourced. And can you also give a little bit of perspective about that?
Yeah, thanks. Yeah, that's another aspect. So to give some examples, like what are we trying to do, right? So medication adherence is a challenge, and what we're trying to design a water bottle with a pill compartment so that somebody will just consume a medicine and drink water, and we will keep track of whether they're taking their medications. When they go to their doctors, understand, they're able to show a report. And then, we keep track of hydration adherence, right? Similarly, anemia is a very big problem, especially for women going into maternity, right? And how can we, like, if you remember early days, and our doctors would just look at our conjunctiva and detect maybe you're anemic or not. So how can we build a machine learning model like that to figure out, that they may or may not have anemia? So it's just prompting them, nudging them to go get their test done, right? So make it very freely accessible, right? Our goal is to build all these machine learning models and access, so someone can just post that picture of their conjunctiva on WhatsApp and it'll tell them whether they're anemic or not, right? So how we make this accessible on WhatsApp in their own local vernacular language, and that machine learning model. Our goal is to build such things and open source it, so it is freely available for anybody in the world.